A pilonidal cyst is a common but often painful skin condition that occurs near the tailbone, specifically in the crease of the buttocks. It results from foreign body reaction to loose hairs penetrating the skin, leading to cyst formation, sinus tracts, or abscesses. It's most common in young hirsute, which means having a lot of hair. Males, annual incidence for this condition is approximately 70,000 cases in the United States. Risk factors we have are obesity, sedentary lifestyle, deep gluteal cleft, family history of this condition, repetitive trauma, or irritation. The clinical presentation might vary, but usually in acute condition we have painful fluctuant mass with erythema, redness, and possible abscess. In chronic condition, we have persistent drainage from sinus tracts, midline pits, and recurrent infections. We have some differential diagnoses like hidradenitis suppurativa, furuncles. We have a video you can watch on top right corner. I'll be putting the link. Crohn's disease, perianal fistula, tuberculosis, syphilis, and in rare cases, actinomycosis. For diagnosis, it's usually clinical diagnosis based on the history of patient and physical exam. But sometimes we can use ultrasound or MRI to specifically in complex or recurrent cases. And we should rule out anorectal fistulas with anal examination in patients presenting with this problem. We have non-surgical treatments for cases without abscess. We could try hair removal, like regular shaving or laser hair removal of the gluteal clefts is recommended to prevent recurrence of the condition. And phenol application. Phenol is a chemical which we apply into the cyst and sinus tracts. It helps recurrence of the condition. Fibrin glue is another option. It can be used alone or with surgical excision of chronic disease. It helps seal the sinus tract and reduce recurrence. For acute pilonidal disease with abscess, we do incision and drainage, which is a first-line treatment for abscesses. And we have some surgical options. We usually use them in chronic and recurrent disease. We have some excision techniques like primary closure, secondary intention healing, marsupialization, and we have flap procedures. And lastly, we have minimally invasive techniques like endoscopic or video assisted procedures. But we should note that antibiotics are usually not recommended unless there is secondary infection. And after the surgery, we have post-op care, which includes dressing changes, hygiene, and possibly hair removal around the site. This was the end of the video. Don't forget to watch the videos I'm going to put in the screen and top right corner. And don't forget to join our channel membership. That helps a lot. And I'll see you on the next video.